Will you stop recording me, you weirdo?
Hi.
Do you know how many cases are found of epilepsy in a year? New cases that are found of epilepsy each year is 180,000 to 200,000 a year. 30% of those cases are found in children. 70% are found in adults. 10% of the American population will experience a seizure once in their life. By the end of my speech, my coworkers will be able to determine if someone has epilepsy. Epilepsy is a chronic disorder, but it is still an important disease. Epilepsy is a neurological disorder that affects a variety of mental and physical functions because of seizures. According to the Mayo Clinic, epilepsy is a central nervous system disorder in which the nerve cell activity in the brain is disturbed, causing a seizure during which you experience abnormal behavior, including loss of consciousness. Approximately 1 in 100 people in the U.S. might experience an unprovoked seizure once in their lifetime. A person with epilepsy has to have 2 or more unprovoked seizures to be diagnosed with epilepsy. According to the Epilepsy Foundation, a seizure happens when a brief, strong surge of electrical activity affects part of all the brain. For those 30 cases that happen to children, some causes include low oxygen during birth, brain tumors, genetic conditions in the brain, such as tuberculosis, or infections such as meningitis. The other 70% of cases the causes of it is missed medicine doses, alcohol use, use of illegal drugs, or lack of sleep. According to WebMD.com, about 1 out of every 2 women with epilepsy seizures tend to occur more around the menstrual period. Epilepsy is diagnosed when someone has 2 or more seizures. There are a few different types of seizures. There are 6 common types of seizures. The first type is called grand mal, or generalized tonic-clonic. This type of seizure is the most common and the most dramatic. It's also the most well-known out of all of them. According to WebMD.com, the patient loses consciousness and usually collapses. The tonic phase of the seizure is when the body stiffens for about 30 to 60 seconds, and then it's followed by the clonic phase, which is where the patient violently jerks their body around, and that also lasts for 30 to 60 seconds. Afterwards, the patient usually falls into a deep sleep. The next type of seizure is also a common one. It's called absent seizures. During the type of seizure, the patient will lose consciousness for just a few seconds. It's just basically like they're blanking out. So it's kind of like staring in space, but not really staring in space. It can happen several times a day, and they might not even know that they're having a seizure. The third type is called myoclonic seizures, sporadic jerks that usually happen on both sides of the body that happens during the seizure. According to WebMD.com, patients sometimes describe the jerks as brief electrical shocks. This could result in the patient dropping, falling down, or throwing objects. The next two types of seizures are called clonic and tonic seizures. This is when a person has repetitive rhythmic jerks that happen on both sides of the body at the same time. Tonic seizures are the stiffening of the muscles. The last type of seizure is called atonic seizures. Atonic seizures happen when someone has a sudden or general loss of muscle tone. This often results in falling. There are other types of seizures, but these are the 6 common types of seizures. After someone has 2 or more seizures, then the patient's doctor will decide what is necessary to do for treatment. The doctor might do a combination of tests to diagnose somebody with epilepsy and the treatment necessary. The tests can include neurological exams, blood tests, EEGs, CT scans, MRIs, PET scans, or neuropsychological tests. The doctor may do an EEG to detect brain abnormalities. A doctor may ask the patient to do something to cause a seizure, and then they'll do a CT scan, an MRI, or a PET scan on it. A neuropsychological test will help the doctor determine what areas are affected. All the tests will help determine what treatments may be necessary. A single seizure, no history of epilepsy, young age, or side effects are signs that they won't do any treatment for it. Treatments can include medications, surgery, or a certain diet they put them on. Medications isn't to cure it, but it's helped to prevent the seizure from happening. Some medications don't work on it, so they might take the medications, but they still might have seizures. For surgery, most surgeries, they only do them mostly in adults because they've fought long and hard on it, and they're still not having any luck with getting rid of the seizures. The diet is called ketogenic diet. It starts with the patient not eating for 24 hours, and then that allows the body to get rid of all the glucose in the body, and then the body begins to burn the stored fat that they have. The diet also keeps this process going. The diet gets 80% of its calories from the fat. The rest are from carbs and protein. The meals are carefully worked out and weighed for each person. Epilepsy has a lot of effect worldwide. It can happen to about anyone. Someone who has a parent with epilepsy is at risk of developing seizures themselves. But not all cases of epilepsy is inherited. Epilepsy has affected someone that I know. It's my nephew Jan. He was actually diagnosed with epilepsy shortly after he was born. He continued to have seizures, and he was hospitalized for the first 3 months of his life because of it. It has a lot of effect on his parents too, because they have to give him a lot of medications. He still continues to have the seizures, and they're doing tests right now, and there's a possibility that they might take part of his brain out that is causing all the abnormalities and everything that go along with it. Epilepsy doesn't run in the family. He was just the one that got hit with it. So epilepsy has a big effect on their lives, just like others who are affected by epilepsy. That's the pin. I couldn't find mine at home, so I just printed a picture. It's purple, and then ours has his name on it. They do, the UK did a fundraiser for it, and they raised $3,000 for epilepsy. Sorry. That's what a normal brain looks like. That's what somebody who has epilepsy looks like. If you can tell, part of their brain is darker than the other part. So, Jane, the most he is affected by is his temporal lobe. He chews really funny, and you have to watch him because he likes to just swallow things. He doesn't like to chew them. So that's the most that he's affected by.
So what I gathered from your presentation is Ryan has epilepsy.